Welcome to this explainer. Today, we're jumping right into something pretty incredible, the reality of medical artificial intelligence. Instead of that classic sci-fi takeover narrative, the sources actually show us that AI is becoming the ultimate tool to give doctors unprecedented reach and precision. We're going to break down exactly how this tech is profoundly improving patient outcomes.
So let's just get the biggest question out of the way right off the bat. It's what everyone wonders when they hear about medical AI. Is an algorithm going to take over your healthcare? Ultimately, is a machine going to replace your physician?
The answer to that is a definitive, hard no. Because as the source material brilliantly puts it, AI offers not replacement, but reach. Think of AI as a tool for equity. It has this incredible power to shrink the physical distance between a tiny rural exam room and top-tier, world-class medical expertise. It's really all about empowering the doctors we already have.
To see exactly how this improves patient outcomes, here's our roadmap for today's explainer. We'll cover the human and AI handoff, spotting diseases much earlier, tailoring treatment to patients, supercharging the healthcare workflow, and finally, the precision surgery revolution.
All right, let's kick things off with Section 1, the human and AI handoff. The scale of this shift is just massive. AI applications already saved the U.S. healthcare system an estimated $52 billion in 2021 alone. It does this mostly by slashing administrative delays and cutting out unnecessary testing. And for you, the patient, that translates directly to fewer confusing bills, way less time thumbing through magazines and waiting rooms, and just an overall streamlined experience.
And this right here is the real goal, a projected 81.5% reduction in human workload. Now, to be clear, that doesn't mean your doctor's taking a nap. It means they are finally freed up from drowning in paperwork and endless data entry. It allows your clinician to actually pull up a chair, look you in the eye, and focus entirely on complex, compassionate patient care.
Moving right along to Section 2, spotting diseases much earlier.
Okay, the contrast here is absolutely staggering. I was blown away to learn that AI algorithms analyzing standard mammograms can actually uncover early signals and predict breast cancer risk up to 5 full years earlier than traditional methods. 5 years! Just imagine having a 5-year head start on a life-saving intervention.
And then there's the sheer speed of this tech. Imagine asking a highly experienced expert to interpret 500 cardiac scans. That takes him roughly 418 minutes. That's about 7 hours. Basically enough time to watch the entire Lord of the Rings trilogy. But in AI, it can process those exact same images with equivalent accuracy in just 1.94 minutes. It's a phenomenally powerful validation system. So, what's the so what here? Well, speed translates directly to saving lives. We're seeing AI hit 93% accuracy in diagnosing pediatric heart arrhythmias and predicting heart failure readmissions with 93% recall. Plus, in super chaotic hospital environments, it's flagging deadly blood infections like sepsis a full 6 hours sooner than current protocols. That is a window of time that changes absolutely everything.
All right, on to Section 3, tailoring treatment to patients.
This brings us to a really foundational concept called precision medicine. We are finally moving away from that old trial-and-error one-size-fits-all approach. Instead, AI lets us pull together an individual's genetic, biomolecular, which just means the unique chemical makeup of your cells, environmental and lifestyle data to design highly targeted therapies for the individual, not the average. You can actually see this working in oncology right now. It's fascinating. AI models are chewing through massive amounts of genomic data and clinical histories to suggest optimal chemo regimens. In fact, these AI recommendations aligned perfectly with human oncologists' choices in 97% of rectal cancer cases. It means no matter what hospital you walk into, your doctor is essentially consulting with the collective wisdom of thousands of successful cases. Let's pivot a bit for Section 4. Supercharging the healthcare workflow. Behind the scenes, these optimizations basically fall into 3 main buckets. You've got clinical decision support to augment a doctor's knowledge. You've got operational analytics to predict things like readmissions before they even happen. And you've got workflow automation, which does things like generate complex radiology reports instantly. All of this works together so that you get the right care at the right time from the exact right staff. Take nurse staffing, for example. It's notoriously tricky, but by parsing patient volumes, acuity, and historical trends, AI takes staffing from total guesswork to a precise science. The sources note this has resulted in massive savings, like $700,000 in just one ICU, all while preventing nurse burnout. And hey, When nurses aren't completely overworked, patient care skyrockets, driving patient satisfaction up by 7.5%. A total win-win.
And finally, Section 5, the precision surgery revolution. This is where it gets really futuristic.
Now, it's important to remember, this is not some overnight disruption. As this timeline shows, integrating machines into surgery is a careful, decades-long evolution. We're talking from the origins of AI in the 50s to early robotics in the 80s, the FDA approval of the Da Vinci system in '99, all the way to the augmented reality and smart surgery we're seeing in the 2020s. It's built entirely on rigorous, careful testing.
We are right in the middle of a massive paradigm shift here. Look at the evolution from traditional surgery, where doctors have to rely on wider safety margins and generalized protocols, to a totally individualized approach. Precision surgery uses high-resolution imaging and real-time AI overlays to perfectly preserve healthy tissue while directly targeting the disease.
Just imagine this collaborative workflow of the future. First, you get real-time data capture. Then, AI uses that data to create a computational digital twin of the patient. This allows the surgeon to literally rehearse the entire procedure virtually before making a single cut. It's like a surgical dress rehearsal. Third, the robot can perform semi-autonomous actions, like perfect suturing. And fourth, crucially, it's all done under strict continuous human oversight.
Of course, it's not all perfectly smooth sailing. To safely navigate this new frontier, the sources point out some very real barriers we have to tackle. The initial implementation and maintenance costs of these systems are exceptionally high. There's also a serious risk of algorithmic bias if the AI is trained on non-representative data, which could actually worsen health disparities. And finally, the legal gray area. Who is legally on the hook if an algorithm makes a mistake? These are complex hurdles that developers are actively trying to solve.
As we step into this wild new era of precision, I want to leave you with this final provocative thought. The technology is clearly ready to save lives and profoundly improve patient outcomes, for sure. But how do we preserve that sacred trust between doctor and patient in an increasingly AI-driven world? It's definitely something we all need to be thinking about. Thank you so much for joining me for this explainer, and keep learning.